definition of tics and what it looks like.
Tics is a movement disorder, and it looks like where a part of the body or multiple parts of the body moves quickly, repetitively, suddenly, and uncontrollably. And there are two types of tics. There are motor tics and something what we call vocal tics. The motor tics is what most people think of when we say tic disorder, and that's a part of the body that has sudden movements. For example, eye blinking, and it's uncontrollable, and sometimes they don't even know they're doing it, or a part of the body is quickly jerking, like twitching, or the face is grimacing, or the arm is flailing quickly, and it could look like a very big movement. Sometimes it's unseen because it's in the torso, and it has a contraction within the central of the body, and it could be just anywhere in the body. The vocal tics is something that is a sound from the vocal cords. That's why they call vocal tics, and those are involuntary also. For example, clearing of the throat, but it's very quick and frequent, and they have no reason to do it. Or sniffing, that could be a vocal tic. Or a very strange one, which is not very common, is sudden urges and quick profanity. And I won't say it, and so that could be a vocal tic. There is a word called Tourette's syndrome or Tourette's disorder, and that is when both are present, motor and vocal. If it's only one or the other, we just call that a tic disorder, like of motor tics or of vocal tics. Sometimes these are very mild. They're just a couple of them at a time, or they can be very severe, lasting a long time, many, many minutes or even hours, and until they're an adult.
What causes tics?
So, like a lot of psychiatric problems, the exact cause is unknown, but it is thought to be a genetic condition or a neurological condition. Sometimes we find it very strange that it would start to occur after a strep throat infection or a strep infection. But definitely what we do know is it worsens. This is something we can try to control. It worsens with stress, anxiety, poor sleep, or sometimes it's an actual side effect from a medication. And the side effect cause is interesting because it's related to the dopamine receptors or dopamine neurotransmitter.
So you said that it could worsen with stress, but can stress or a certain traumatic experience actually cause the tics to start?
Right. I don't think I can agree with that those cause it directly. If it looks like it did, I would say the person already had a propensity, already had a vulnerability to have developed tic disorder, and maybe an excessive stress or anxiety surfaced it or triggered them. But stress or anxiety, they themselves are not the cause.
Then can tics form as a habit that has solidified and fossilized?
Actually, I would say no. Most people, children, adults, I don't think they want that habit. So a true tic disorder, that's what I'm saying, is not something that they would want to continue. But stress and not managing anxiety and those things, that can be the habit they really should control so that it's not full-blown constant ticking.
Do you think that tics are also connected with other neurological or other mental problems?
Right. So when I mentioned about anxiety, there are certain anxiety disorders that bring these out more, or there's more commonality that they come together. For example, OCD, obsessive compulsive disorder, and tics. Sometimes ADHD and tics. Sometimes ADHD meds at times can cause side effects of tics.
Do you think that anxiety exacerbates tics?
Yes, it could make tics worse or last longer. So some people can have tic disorder by itself, but what we do see is they have a tic disorder and they have a lot of other conditions too.
When you see this forming in very young children, I'm sure parents are wondering why. What can we tell them?
Yes, that question of why is so difficult, right? Because the cause is not really known. What we do encourage parents is we can ask why forever, but let's help the child right now. What can we do to help reduce these things?
What are typical treatments? And do they work to completely heal symptoms?
For moderate to severe level of tic disorder, a comprehensive evaluation is helpful to determine what kind of level of treatment is needed. So, for example, we do use medications to help control the frequency and severity, meaning it's happening every day, noticeable throughout the school day, and it is causing so much attention, negative attention from others. Then we would use medicine. I would say that not 100% of the time, but it's helpful. And there are a few severe cases that even medications um, can't really help that much. Therapy is also, or counseling, is used to reduce the general anxiety. Because remember, I mentioned anxiety can increase and worsen the severity of tics. The method called HRT, which is called habit reversal therapy, even though I just mentioned that it's not really like a habit, but in this training, we can teach children to learn how to increase their awareness of the tics and the urges that might come right before. Because you can sort of learn that it's coming or something is about to trigger them, and then use replacement behaviors, a distractant of that sort.
Some parents don't really know what to do about the tics, so will it be reasonable for us to just hope that it gets better on its own?
There are certain tics that are transient, meaning they're there just for a brief time in their childhood, actually. And they're not that severe, or they only occur during stressful moments. So, not overly focusing on them sometimes is a good idea. Like, why are you doing that? What's going on? Like, maybe we don't have to do that. But if the child themselves are experiencing distress, or they're coming home and sharing with their parents, I keep doing this movement and everyone's mentioning it, and I don't know how to stop them. Then maybe seeking assistance from a medical professional is appropriate at that time. So the answer to that question is difficult because some do actually go away.
What can you say to parents of children with tics who struggle with the stigma and judgment from others?
Mm. Remember that the children and teens struggling with tics, that they're not able to control these on their own. And so they should not be blamed or punished or scolded for the behaviors that are coming out as if that they're purposely doing those things. Teasing and judgment from others, especially from their own family members, it could definitely hurt their self-esteem, and it will increase their distress. And increasing distress will worsen tics, right? So we have to help them um, find that balance, and that it doesn't bother me that you're doing it, so that they don't feel so embarrassed or self-conscious that is affecting other people to watch them. We have to remind them that they themselves are lovable and that their identity is not defined by behavior or the ability to control these tics. For example, I don't think this is a place where we use positive reinforcement. Oh, today you don't have any tics. Yay! Because that's not fair, right? It is not a behavior that they can control on their own. The next encouragement is to assist them, help them maximize their strength and what they could have control over. Sometimes it's consuming their thoughts and their self-confidence and self-worth, whether or not they had tics that day or not. We can help them focus on what they are doing, what they're good at regarding their studies or their hobbies or sports or music. And definitely, we have to help them know who they are, right? Like I said, their behaviors, their ticking, it is not what defines them. What defines them is their identity as a child of God. And it's okay that as a child of God, you have a few tics. And we have to validate and normalize that your body just does that, right? And that's okay. And knowing what they have, because they might say, I have so many tics, I have so many weird behaviors. How about that replacement of how many blessings do you have as a child of God, right? To reframe what they're focusing on. And parents should do that too about their children. And as parents and as the child suffering from it, to develop an acceptance. That acceptance can lead to peace. And then this peace, which is opposite of anxiety, can help decrease the tics, right? So if that occurs, then they can find other distracting ways, and they're not even that noticeable anymore. So I just wanted to emphasize about identity, focusing on blessings, not the behavior, and what it means to have acceptance and peace.